Simply the collaboration allows us to impact our region on a much greater level.
Usually if you need to find something out, there's someone in Mahia that can help you get there.
And I'm passionate about helping people stay healthy. Because of that, I joined the board of Mahia.
The belief is that improved health in a region will be good for the economy, good for industry, good for business owners. And what this group has done is pulled together representatives from universities in the area, colleges, industry, the healthcare system, physicians both currently working and retired, and as a group are committed to taking the steps necessary to improve health in the region.
I think it's the one venue in the region that brings together stakeholders in healthcare and the community at large in ways like no other venue does. I mean, it really brings together people who are in the business of paying for healthcare, people who are in the business of managing it, people in the business of providing healthcare, customers, employers, and really people in the community just interested in improving the region's health. You just don't find a table like that that has that kind of diverse stakeholders anywhere else.
I've been working with Mahia for a year, and I find them to be a very creative organization. I think I'm most impressed with the board. Their president, Dr. Bassi, is quite a visionary. She is well known throughout the country and has done a great deal of work to bring the national focused ideas into right here in the 14 county area that Mahia serves.
Simply the collaboration allows us to impact our region on a much greater level.
Usually if you need to find something out, there's someone in Mahia that can help you get there.
And I'm passionate about helping people stay healthy. Because of that, I joined the board of Mahia. We feel at Mahia that true change is going to come from the community level and from people working together to really try to impact the people and the communities that we serve, more so than will be legislated from the top down. So because of that, we've established a group of stakeholders together to sit around and talk and to put some plans into action on how we can benefit our communities. An example of one program is a program called Choosing Wisely, where we are encouraging our patients and members of the healthcare community to take more responsibility in what tests are done to them, what tests they need to have done, and to ask questions about the benefits and risks and possible side effects of any testing that might be done. Mahia is taking a lead role in the community to try to educate our providers about this campaign and then have it passed down to our consumers so they can make intelligent choices about the health care that they get.
Mahia has been able to obtain for our region over $2 million worth of grants that we would not have obtained without the work of Mahia. This is really significant in several areas. One is Saginaw Pathways to Better Health, which is a program that allows us to use community health workers in multiple venues to interact with patients who are high utilizers of the system. So first of all, they cost a lot to the system, but they also have a lot of medical needs that aren't necessarily coordinated well or adequately met. And the community health worker, through the utilization of that grant, allows those patients to better access health care, utilize it better, and obtain better health while decreasing the cost of the care and improving their ultimate outcome in health.
Well, one of the Mahia projects pretty early on was to take a look at county health rankings data and then identify how that data stacks up for the entire region. They've come up with some criteria in various areas which have to do with health outcomes and a lot of different health factors, including things like behavioral health, some of your lifestyle choices, access to care, environment, things of that nature. But what's really neat about it is you can compare counties across the entire United States. We can look at these various health factors and health outcomes and identify things that are really threads across the region.
Simply the collaboration allows us to impact our region on a much greater level.
Usually, if you need to find something out, there's someone in Mahia that can help you get there.
And I'm passionate about helping people stay healthy. Because of that, I joined the board of Mahia.
The goal of the population health team is obviously to improve the overall health of our whole region and individuals within the region. And I think it fits really beautifully with what Mahia is trying to do overall, because their overall vision is for us to be the healthiest, thriving community with high quality care. So that's really what they're trying to achieve in the work that they're doing. And so population health, so how do we carry that out, and how do we make sure that people throughout the region engage in healthy behavior?
The benefits of having an organization like Mahia in our region, I'd like to compare to the community foundations in the state of Michigan. In the state of Michigan, we have like a big brother that looks out for all community foundations in the state of Michigan called the Council of Foundations. And they truly are the advocate, the organizer, the trainer, providing resources that we as one sole community foundation may not have the resources to do so. And I feel that Mahia does that for the regions it represents in our area. I mean, we in Saginaw County alone, we have hospitals, we have health clinics, we have a health department, we have organizations that focus on health. And they may primarily be focused on a specific area, of course, and hospitals are attending to the immediate needs, the health concerns or health needs that individuals have and need addressed. At our health clinic, a lot of times they are looking at it from a county's perspective. And then our health clinics, a lot of times, like our health delivery, they're addressing the low income and helping out with their needs. But Mahia is looking at it from the big picture. They are really looking at all the needs from a greater region standpoint, and may be able to identify ways that we can collaborate more, that we can address individual county issues or concerns, but in a larger, more impactful way. So I truly see that as a benefit in having Mahia be that active player in our community.